am at least 18 years of age and I consent to this assessment.
Can I come in?
Yes.
Applying hand hygiene. Hi, my name is Megan. I'm a student nurse from Chamberlain. I'll be doing a head-to-toe assessment on you today. Do you need to go to the bathroom or do you need anything before we start?
No.
Okay, we're going to start with 4 random questions. What's your name?
Brendan.
Where are you at right now?
Chamberlain Hospital.
Why are you here?
For a checkup.
And what month is it?
May.
Okay, so the client is alert and oriented times 4. Next, we're going to assess your allergies. Do you have any allergies to the environment?
No.
To latex?
No.
To the medications?
No.
Or to food?
No.
Okay, so he has no known allergies. Next, we're going to assess his pain. Do you have any pain anywhere in your body?
No.
So from a scale from 0 to 10, what would you rate your pain?
0.
Okay, and then his vitals, blood pressure 120/80, pulse 80, respirations 18, pulse ox 98%, and temperature 98.6. Next, we're going to go with general appearance. He looks his stated age. He looks like he is not in distress at all. He has no injuries. He's well dressed for the weather. He has pink undertones. Next, we're going to go to his skin. For his skin, he has pink undertones, like I just mentioned. It's warm to the touch. It's dry. Next, we're going to check your nails. There's no clubbing. And we're going to check his capillary refill. Less than 3 seconds and less than 3 seconds. On his skin, we're going to check if there's any tenting. And there's no tenting, so his skin is elastic. Next, we're going to go to your head. Your head, we're going to assess your hair. So can I touch your head?
Yeah.
Okay. When looking at the hair, there's no infestations, there's no lumps, there's no bumps. His hair is distributed evenly. His face, just looking at it generally, his face is symmetrical and there's no deformities. While I'm at the head, we're going to do cranial nerves. So can you please close your eyes for cranial nerve 1 and smell this. What does it smell like?
Peppermint.
Okay, so cranial nerve 1 is intact. For cranial nerve 2, can you read my name and my badge?
Megan Lunkus.
So his visual acuity is intact. For cranial nerve 3, 4, and 6, I'm going to use my pen light. And just stare at me, please. Okay. So his pupils are equal, round, and reactive to light. And can you look at this flashlight and just follow it? And they're accommodating. Next, we're going to do cranial nerve 5. So can you please close your eyes? I'm going to touch you on your face and let me know if you can feel it.
Yes. Yes. Yes.
Okay, and then can you also clench your jaw? Okay, and the patient clenched his jaw. For cranial nerve 7, we're going to do his face, so facial symmetry. Can you smile for me? Can you frown? And then can you blow up your cheeks? So his face is symmetric. For cranial nerve 8, we're going to do a hearing test, and it's called the whisper test. So I'm going to say a word, whisper a word on each side of you, and you're just going to have to repeat the word. Okay? Pizza.
Pizza.
Okay, I'm going to go on this side.
Pasta.
Okay. For cranial nerve 9, we're going to check your gag reflex, so go, ah. Okay, and we see the uvula. For cranial nerve 10, can you say A-E-I-O-U?
A-E-I-O-U.
And then can you swallow for me? Okay. For cranial nerve 11, can you shoulder shrug against resistance? And then can you turn your head to the left and then to the right? Okay. And then for cranial nerve 12, can you stick out your tongue? And then you could go, can you move it side to side? Okay, so cranial nerves 1 through 12 are intact. Next, we're going to go to your neck and your range of motion and all your lymph nodes. So neck, the trachea is midline. I see you move your head back and forth, up and down. He has full range of motion. Next, I'm going to check his lymph nodes, see if they're swollen. And his lymph nodes are not swollen. Next, we're going to go to your eyes. So like I said before, his pupils are equal, round, and reactive to light and accommodating. His ears, we're going to check if there's any drainage. No drainage in that ear. No drainage in that ear. And the skin is intact. And his hearing is intact from the cranial nerve test. Next, we're going to go to your nose. Your nose is midline. There's no drainage. And then we're going to do the nasal patency test. So can you hold one nostril and breathe out? And then the other nostril? Good. Okay. So he has nasal patency. Next, we're gonna go to his mouth. His lips look pink and moist. Now we're gonna open his mouth. Okay, pink and moist. His teeth look straight and no cavities. Next, we're gonna go to respiratory. So I'm going to listen to your lung sounds. All right, can you take a deep breath in? Okay, and to the back. Okay, his lung sounds are clear. He doesn't look like he's using any accessory muscles to breathe. His chest expansion is 2 to 1. And yeah, now we're gonna go to cardiovascular. I'm going to feel your carotid arteries. On this side. And they're 2+. I'm also gonna listen to see if there's a bruit with my bell side. And there's no brewing. Now I'm going to listen to your heart sounds on your chest, and then I'm going to listen to your apical heart rate for 1 minute. So aortic, pulmonic, herbs, tricuspid, and mitral. And now I'm going to listen to your apical heart rate for 1 minute. Okay, and his heart rate, his apical heart rate was 80, and his rate and rhythm were regular. Now we're gonna go to your abdomen. So if you can lay down for me. So first I'm going to inspect his abdomen. It is flat, it's symmetric, it has pink undertones, and there's no pulsations going on. Next I'm going to auscultate it in all 4 quadrants. And we'll start with the right lower. Right upper. Left upper. And left lower. Okay. There are bowel sounds in all 4 quadrants. Next, I'm going to percuss. Okay, and then I'm going to palpate. Can you please let me know if you have any pain? Any pain? And there was no masses when I was feeling. Now we're going to go to your peripheral and musculoskeletal. So you can sit up. So as I watched him walk in today, and his gait is steady and normal, we're going to check his strength in both his upper extremities and his lower extremities. So we're going to do upper first. So pull towards yourself, and then push towards me. Okay, 5+ strength in the upper extremities, and we're going to do the same thing. So push towards me, and then push towards yourself. Okay, and 5+ there. Next, I'm going to feel for pulses, his pedal pulses, and those are 2+. His skin down here is not paler. His pink undertones. Are you having any pain in your calves? Okay, there's no pain. Can you wiggle your toes for me? And can you feel me touching your legs?
Yeah.
Okay, so the 5 P's are intact. And do you have any trouble when you're walking or getting up and going fast? Do you feel dizzy or anything? Do you use any ambulatory aids when you walk?
No.
Okay, well this concludes my head to toe assessment. Do you have any questions or do you need anything before I go? Do you want water? Have to go to the bathroom?
No, thank you.
Okay, well thank you for participating in my head to toe assessment.
You're welcome.